Ladies, let's face it, aging isn't exactly a thrill ride. Once the lines and creases start forming, there's no turning back. Or is there? Dr. John O'Brien is with us today to tell us about how his med spa, all about it, and his array of products could help turn back the hands of time. Welcome.
Thank you.
It's great to have you here. I have actually, been out to visit you several times, and you've been working with me on my skincare, and you have an amazing facility, and we've got some video to show, actually. Let's start off by talking about your med spa.
Well, great. Yeah, the med spa we opened in December of 2006, and it's part of the St. Petersburg Center for Plastic Surgery, which is a fully accredited both surgical as well as non-surgical facility. And obviously what we're going to talk about today kind of focus more on the med spa, the non-surgical things that we can do to try to increase longevity, improve the quality of your skin and tone, etc., without surgery, that is.
Right, because we're seeing so many people, actually there's so much talk of plastic surgery and so many things that people are having done, yet what I really love about your med spa is that you really do help women and men kind of actually, I say turn back the hands of time, but there's so many different things that you can do to prolong actually having to have any kind of plastic surgery.
Yeah, and I think that's definitely true, Michelle. I think the tendencies are these days are that patients want to prolong surgery as long as they can, and there really are a lot of new exciting technologies that have been scientifically tested and proven to help with some of that, and we're going to talk about some of them today.
Yeah, let's start with that as well. The skincare I want to talk about first of all. You put me on a skincare line called Obagi about 4 or 5 months ago, and I've seen a tremendous difference in my skin because I've not only got wrinkles but acne. And then my skin texture, sun damage, all of these things in which this Obagi line has helped me with considerably. And I know you've got some pictures that you brought today too to talk about the Obagi line. Let's talk about...
Yeah, and I think the Obagi line in this first picture that we have here is really just looking at some pigment issues, and sort of a before Obagi would be on the left, and an after or current Obagi user on the right. We'll just run through a series of some pictures showing different things that Obagi can help you with. And there's a different age patient, obviously acne. And Obagi has a specific acne line. Remember, Obagi is a prescription, physician-controlled program, so you really want to work tightly with a physician who prescribes it and with their medical estheticians. And this is something as well, a little before and after as well, just showing an improved glow that you can get, a more youthful look, some of what Obagi can do. And I think obviously the foundations for youthful appearance are going to be the skin. So that's why, at least at our med spa, a lot of our procedures are for that. And this is just some real severe sun damage and how Obagi can help some of that.
And the Obagi line, like you said, it's something that's specific to your patient. So when I walk in, I have specific needs, and depending on who you are and what your age is, and you have acne or a variety of things. And so talk about why Obagi is such a great line that you can be so versatile and actually help with so many different things.
Well, I think that's just it. There's really a lot of different options with their product line. If you have trouble with acne skin, they've got a line for that. If it's dry or if it's more oily, more textural, more sun damage, we can tailor our approach based on your needs and also your goals. Some patients want to be a little bit less aggressive as they start out. Some patients want to be a little bit more aggressive and may even consider blue peel, which is their form of an acid peel for sort of the deepest improvements. Yeah,
because I think, especially my background as a makeup artist, I have so many clients say to me, what's the best cleanser? What's the best moisturizer? Well, what may work for me may not work for someone else, because I have a variety, a lot of women have a variety of issues, and men too, I'm not including them, but you also have some new technology that's called Fraxel.
Correct.
Talk about that too.
Well, the Fraxel has been around for a little bit. We've recently gotten involved with Fraxel, and we've been happy with it. Fraxel is a laser treatment, but it is minimal downtime, which really was one of the problems, is that whether it's surgical or non-surgical rejuvenation, the patients really don't want to have a lot of downtime, and this is some of the patients that we can help with the Fraxel technology. Some acne scarring and sun damage right there, some before and after pictures after several treatments with Fraxel. Fraxel is going to be several treatments, as I said, minimal downtime, so patients can have it on a Thursday and go to work Friday, the majority of them. There's something showing some skin sun changes, some of the sunspots that can be helped with Fraxel.
And what does the laser do? Does it actually penetrate deeper into the layers of skin? And you said it stimulates collagen, and what does it actually do?
That's exactly right. It actually is what we would call sort of a minimally ablative laser, which means it actually vaporizes or disrupts tissue. And it does it in a way that your skin, many of the bridges are left intact in between, so that your skin can heal in a much quicker time frame without a lot of downtime, so to speak. And there's a picture showing what we can do with some wrinkling around the eyes, which is a common area where we would use the Fraxel to treat. Now, the Fraxel treatments, you would generally need to have anywhere from 3 to 5 treatments, but as I said, there's not significant downtime with it. A little bit of redness and swelling in the first 24 to 48 hours, and there's a picture showing some of the textural changes that you can see and the improvement that many of us have to deal with in terms of post-acne scarring.
Right, and how long does this last, the results?
Well, that's a good question. I think that we don't have great long-term studies, but we know that certainly the results have been around for anywhere from 4 to 5 years, and it's certainly going to buy you a little bit of time. I don't think it's going to replace the need for surgical lifting, but in terms of skin and textural stuff, it can do some real great things for patient skin.
And you have something else called Thermage as well.
Yeah, Thermage is also a technology that's been around for a while that we've been utilizing really for about the past year and a half. It's using radio frequency, which is electrical energy. Once again, it's going to be a treatment that doesn't have significant downtime. It's kind of a mini lift per se. Once again, it doesn't replace surgery, but it's for patients who want some tightening to the deeper structures, whether it be cheek, eyes, brow. You can use the Thermage for tightening around the arms, abdomen as well. It will buy you a little bit of time. I don't think it replaces the surgery, but for those patients that may not want to consider surgery or may want to get a couple of years before they do surgery, if they decide to do it at all.
And if people are interested in, because we've given so much information, there's so many more things that you have, they can go onto your website, correct? And there's an array of information there.
Yeah, and we do have a pretty informative website, I think, that you can navigate around that goes over various things, including both our surgical practice as well as our non-surgical practice and the med spa. We do in-office seminars. And I think it's obviously worth a patient's time if they're considering this stuff. If nothing else, get online, get some information. We also run various seminars as well as specials on product lines from Obagi to the Fraxel to Thermage. And obviously we can, our best bet though, quite frankly, is to always meet with the patients or potential patients and go over what they may be interested in.
Well, and that's what I love for me, because like I said, the acne, the wrinkles, I mean, seriously, I had some cystic acne on my neck from hormonal changes. You gave me, a very, pinpointed my issues, gave me the skincare regime, and then it asked me to start using a little bit of Retin-A, which I was nervous about, which has really, really helped the texture of my skin. But 2 weeks later, you guys had me back in the office, making sure I was okay, and then following up with a phone call. I mean, you really stay in touch to make sure your patients are getting the best results, and that's just awesome. My skin looks better than it has in 5-6 years. So it's really, really, I recommend to everyone that they give you a call.
Well, great.
And we're going to have here, we're going to learn everything you've seen and heard today. If you want to learn more, all you have to do is call 727-341-2408. And when you do, ask about this special Studio 10 offer. Schedule your free skincare consultation at the Med Spa today, and you'll also receive a free Vizia digital skincare analysis. That is worth $75. And also be sure to visit studio10.tv to learn about some more very special offers and discounts for Studio 10 viewers. Plus, Dr. O'Brien has many upcoming seminars at the Renaissance Med Spa of St. Petersburg, all of which are totally free. In fact, tomorrow, February 20th, the topic is Thermage. Learn how to decrease the signs of aging with this non-invasive procedure. The seminar starts at 6 p.m. Or is your skin just in need of a touch-up? On March 12th, Dr. O'Brien's staff will be discussing the benefits of Fraxel. This seminar also begins at 6 p.m. Remember, these seminars are free, but seating is limited, so be sure to RSVP today to reserve your seat. Thank you so much.
Thank you.
Okay, when we come back, back pain could be a thing of the past when you visit MUA of Tampa Bay, but we will tell you why when we come back.
This segment was paid for by John J. O'Brien Jr., MD.